Hello and good morning, everyone. Today we're going to talk about cholera. It's a sad, unfortunate, revolting, disgusting bacterial infection that's happening all around the world. I went on a hunt for a cholera patient to get a more realistic and personal education about cholera, what goes on inside the body, and how it's transmitted. Welcome to Factual Infections. Thank you. I'm very glad to share my story. I would like to start by asking, how'd you get cholera and when? Actually, I was back in Vietnam, protecting my country and my people. You're welcome, everyone. And, getting rid of those communists out there. And I was dumb enough to drink some groundwater after a rainstorm. So you are confirming that it is transmitted orally? Yes, it's transmitted through the fecal-oral route. If the water is contaminated by an infected organism's feces, whoever drinks traces of that water is likely to become infected as well. Yeah, me and a bunch of buddies, we all had cholera back then. It was kind of a normal thing. It's very common in war zones. They weren't dumb enough to drink groundwater like I was. I understand that the bacteria that causes this infection is called Vibrio cholerae, right?
Yes.
But I honestly, personally, do not have any understanding about how exactly it affects the body and how it can lead to an infection. So I have done the honor and invited a medical specialist right onto our set to ask them exactly how it affects the body. So here is Dr. Phoebe Starr. Hi, I am Dr. Phoebe Starr, as our lovely host just mentioned. But anyway, cholera, my gosh, am I right? I'm so sorry, by the way. So cholera, it is mostly a gastrointestinal system kind of problem, which that would be all this junk right here. So the first thing that is going to happen upon consumption would be the bacteria obviously would go to your stomach. In there, the stomach acid sometimes will kill off all of that bacteria, only if you had consumed a very moderate amount of bacteria, okay? But, in some cases where your stomach acid may not be strong enough or you have consumed a very large, hefty load of Vibrio cholerae, not enough will be killed off. So, from there, they move to the small intestine. But please do tell, what happens from there? More specifically. So inside of the small intestine, which is where the bacteria have relocated into, they release a toxin, a very poisonous toxin, called CTX. This poisonous toxin binds to the walls of the small intestine. And from there, it blocks or at least disrupts the flow of sodium chloride. Now, it's not just the small intestine that it infects. In the large intestine, we see very, very bad inflammation. This disrupts the absorption or reabsorption of fluid after it has already been lost. This would also lead to the very long and outdrawn symptom of diarrhea. Now back to the toxin actually. The transport of chloride through a chloride channel over here, otherwise known as CFTR, or the cystic fibrosis transmembrane conductance regulator. Now, it is actually disrupted by the CTX once the CTX has already disrupted another internal body structure called the CAMP. CAMP stands for the cyclic adenosine monophosphate. Now, that is actually relating to the way that water flows among the cell membranes. So the cells would become dehydrated. Since they're dehydrated, a mucus is created and a large amount of electrolytes are lost. So here are the cells with their mucus coating layer around them. Now, water is then secreted into the bowels and excreted as watery diarrhea or vomit. Now back to you. As Dr. Feedy said, there were symptoms of diarrhea and vomiting. Did you experience these at all? Yes, I did have diarrhea and I did experience some vomiting, but Those were not my only symptoms, of course. I was often nauseous and constantly dehydrated. I am a little bit parched right now, so if somebody could, my muscles. Also, there was some problems with my muscles. They were either very weak, very flimsy, or very cramped, very tense. Also, I remember one of my nurses back in Nam, she told me that my blood pressure was kind of low or decreasing. Wow, I cannot imagine the struggles that you must have gone through. But one time I did go on one of those cheese cleanses. Anyway, could you actually tell us about some of the treatments that you went through? Right, well, I was actually stuck back in Nam for my treatment, and all they could do for me there was boil up some rice and give me the leftover liquid, and I guess that did the trick. I mean, I'm here today, right? But, I know there are definitely some more modernized methods that people use today in America. Oh, really? What were some of those methods? I know a big one is fluid and electrolyte replacement, and that is a solution made up of water and salt and glucose. You can drink it, or you could have it injected through an IV. Were you prescribed any antibiotics as well? I was put on tetracycline and norfloxacin, I believe, and just for backup for my rice water treatment because it was such a low-grade form or method. But just like any other infection, antibiotics were just used to help fight the bacteria and cause less fluid loss overall and over time. I also did make a few changes in my diet, which I believed really helped, or at least had some sort of impact on my recovery. How exactly did you change your diet? I ate less fatty foods and foods high in protein, so I mainly focused more on foods that were high in carbohydrates. Wow, sounds super bland, am I right? Let's refer back to Dr. Feedy to see how cholera is prevented. Well, to start, there's the obvious methods of staying out of areas with poor waste treatment systems and maintaining good sanitation. But besides that, there is a basic set of guidelines. Boil it, cook it, peel it, or forget it. Water should always be boiled before consumption. Fruits and vegetables should always be cooked thoroughly, and meat also, and eaten while they're still hot before consumption, of course. And peel it. Fruits and vegetables, mostly fruits though, should be peeled very directly prior to eating them. So it's all pretty basic stuff that anyone even here, could think of. I think so. There are also a few vaccines, but I wouldn't waste too much time on them because they're very well known for not being too effective. Really? Is that so? The 4 vaccines that I'm aware of are very similar to each other in a few different ways. There's Cholera and Vaxchora, which are live cholera oral vaccines, while Dukoral and Shankal are inactivated oral vaccines. Now, oral, I mean they come in the form of a small pill or tablet, which can be taken with or without food, but they don't really provide full immunity to any strain of Vibrio cholerae, which is why I personally wouldn't trust them, and they also don't last that long. Well, thank you, Doc, for coming out today to join us on the show, flying all the way out here from Africa. It really means so much to us all, and thank you for educating us a little bit more. Although we do hope that you didn't bring any Vibrio cholerae with you, am I right? Yes, don't worry. For our honorable guest, we thank you dearly, truly, personably, for being alive and sharing your story. Yeah, thank you. That is all for today's Factual Infections. Thank you all for watching. Hope to see you next time.